Hello everyone. So today I'm going to discuss about most asked question from cardiovascular system during NCLEX examination. So at first you must know about the cardiac auscultation landmark, which is oftenly asked in diagram. So you must know about normal heart sound, that is S1, S2, S3, and its location. So for short pump, you can also remember APTEM. For more details, please study in cardiology section. Another most important thing you must know while studying the cardiology is about ECG lead placement. You must know about normal sinus rhythm diagram and its measurement. You also need to know about the Holter monitoring interventions, pacemaker site and post-operative interventions, defibrillator and cardioversion, similarly cardiac arrest management, which are most asked during the examination. There are certain cardiac markers that you must know about. It's normal level and significant raise, especially in case of MI and heart failure. You should also know about mean arterial pressure ranges and cerebral perfusion pressures formula. Also, you must know about the certain landmark area in order to distinguish between the permanent damage or death of the cells. Similarly, these are the topics they will ask during the examination. From shock, study about its type, causes, signs and symptoms, and prior nursing action. The most important point you must know in the shock is about EpiPen. The client teaching regarding EpiPen, it is asked during the exam. In heart failure, you need to know about left side and right side heart failure signs and symptoms, along with its immediate management. Similarly, in pericarditis, you must know about the chronic pericarditis, its causes, signs and symptoms, and ECG changes. Especially in pericarditis, the signs and symptoms like cardiac tamponade, which is especially seen, so you must know about it. In endocarditis, they ask about the definition, causes, signs and symptoms. For signs and symptoms, you can refer from JANE as a short form. Similarly, you must know about its intervention and prevention. In cardiac tamponades, Beck stride is most important, so you must learn about it. You should know about the pericardiocentesis also. And in angina, they usually ask about its causes and assessment along with diagnostic test. From MI, you must know about its definition, location, diagnostic test. For example, troponin, which usually rises within 3 hours, and it is most reliable test. You must know about the ECG changes, where it is shown as ST elevation, along with assessment, complication, and acute interventions. Also, do not forget to study about PTCA. Usually, in exam, they ask you about the post-procedure transfer and home care intervention. So, especially focus in this area. From venous and arterial disorder, usually signs and symptoms along with its management are asked. The different types of venous and arterial disorder like DVT, PVD, peripheral artery disease, Raynaud's and Borger disease. During my NCLEX examination, there was one question where they had asked me about signs and symptoms of Borger's disease. So it is important. From aneurysm, they ask you to distinguish about the either it is aortic, abdominal, or rupturing aneurysm. During my exam, there was one question regarding the abdominal aneurysm, and the question was about how do we separate or how do we know that it is abdominal aneurysm. You must know about the post-operative management after thoracotomy, which is most commonly asked during your examination. Similarly, for cardiac arrhythmias, you must know about everything in detail because it is very, very important. So especially in this case, they ask you about the causes, signs and symptoms, and its management along with the ECG changes. So do not forget to study about the ECG changes, and make sure that you remember each and every diagram of the arrhythmias, because during the NCLEX examination they give you the figures of ECG changes, and they ask you they ask you about whether it is ventricular arrhythmias or something else. So for new posts, stay updated on my YouTube channel, and do not forget to like and subscribe. Thank you so much.